Today, I want to talk to you about pacifiers. I know that oftentimes it's kind of a point of confusion when a dentist you often hear from dentists, don't use a pacifier, but then other medical professionals might recommend a pacifier. So I wanted to dive into that in a little more detail with you. So the American Academy of Pediatrics does recommend the use of pacifier from the age of 1 month, beginning at 1 month, with weaning beginning then in the second 6 months of life. So using the pacifier starting around 1 month and tapering off around 6 months moving forward. So the reason for using a pacifier would include that it does provide pain relief for little ones. It releases kind of feel-good hormones that can help make them feel better if something's not feeling good, if they've got some reflux or otherwise something's going on, and it helps them feel better. It also has been associated with reducing the risk of sudden infant death syndrome. So sleeping with a pacifier at that age is recommended. The reason why the recommendation is to wait until 1 month to introduce the pacifier does have to do with allowing time for good breastfeeding habits to form. So there can be some confusion on feeding cues early on. So that's why the recommendation is to wait until 1 month to begin the pacifier. The exception to that will be for suck training to prepare any sort of preemie baby. They need actual help in training in order to prepare for bottle feeding. So while the generalized advice is to start use of pacifier at 1 month, in the case of a preemie baby, starting much sooner is advised. And then pacifier recommendations. So on the right, I've got two photos of the Philips Advent Soothie. What I wanted to show you there is that it's all one piece. So sometimes when you see pacifiers, you've got kind of the round base and then a separate nipple portion that's attached. That can increase risks of choking hazards. So looking for a pacifier that's all one piece is advised. And then also, as you can see in that second photo, instead of having a kind of a solid back of the pacifier with a little handle on it, having open access to the inner portion of the nipple to allow the parent or any sort of lactation consultant or professional you're working with to be able to put a finger in there and help with suck training. So that is kind of some of the considerations when choosing a pacifier. Now, all of that being said, prolonged use of a pacifier is known to cause some problems. So the longer a baby uses a pacifier, there is more increased risk of increasing ear infections, as well as increased risks of negative effects to skeletal and dental development, as well as muscle tone of the lips, of the tongue, the muscles around the mouth. So even though the pacifier is recommended from about 1 to 6 months, we want to begin to wean that habit off during the 6 to 10 month time frame. Once baby is asleep, kind of remove that pacifier and gently shut their mouths to make sure they're training themselves to breathe through their nose. So all that being said, there are so many cases where children are older and they still have a pacifier habit. So what can or should be done? I think between the ages, at an older age, you really need to seek some professional help. There are professionals, a variety of professionals who can help, and we're going to talk about that. But, at the very least, we want to make sure that any sort of unwanted oral habit is gone well before the adult teeth start to enter the equation around age 6. But we also want to understand, why is the habit still going on? So some looking at when the pacifier is still being used, and in addition to a pacifier, is there a thumb habit? Do they suck on a blanket? What else is going on with that habit? Sometimes, like we said, it can be to kind of prop the airway open and help with breathing. So looking at, does your child seem to have nasal congestion? Are they mouth breathing? Why, figuring out why it's harder to give up the habit will help determine how to get them to give up the habit. So sometimes it might be just replacing the habit with age-appropriate toys or other appliances. I will put a link below with some recommended toys or appliances, but babies and children are exploring the world around them through putting things in their mouth. And we just want to make sure that whatever toys they have are encouraging good growth and development instead of having some sort of negative consequence. And I mentioned professional support. So you might have a very knowledgeable pediatrician or ear, nose, and throat doctor that can help you. But in some cases, you need to see a professional support who truly focuses on oral habits. That may be a pediatric occupational therapist, that might be speech language pathologist, an oral myofunctional therapist. These providers can help get to the bottom of why the habit is ongoing, and they can also help you eliminate the habit. So I know a lot of times parents feel some feelings of shame of like, oh, I know my kid shouldn't still be having this habit, but there's a variety of reasons why it's just been easier to let my kid continue with this habit. And these professionals are understanding of all of these circumstances. They've seen it all. So don't worry about presenting yourself to them for help. They know how to dive in and figure out why this is happening and help you eliminate that from being a variable. So that's what we want. I'm here to help you if you need to find a provider near you, or you want to do a screening to assess maybe if airway health is part of the equation for your child. Schedule a free consult with me at the time of this recording, or send me a message, check on different ways that I can help. So let me know. Hopefully this helped clear up a little bit about the confusion surrounding pacifier recommendations. Thank you.